Hey everybody, Jason here, Taylor Physical Therapy and Wellness. Getting back to things after a nice holiday break. Hope you guys had a Merry Christmas and a Happy New Year. We're going to get back to exercises today with exercises regarding shoulder pain. This type of pain can be described as a deep, dull, achy, annoying sensation, typically felt on the outside of your shoulder. This is not for radiating pain that can go down into your arm. As always, before engaging in any kind of physical activity, if you need to do so, if you have any health issues, any recent surgeries, make sure you have clearance from your doctor to do so. I'm going to show you 4 exercises that I think you should try. If you're having any pain in your shoulder, see if we can help get that area stronger, see if we can help you with your symptoms. First thing, I want you to lie down on a couch, on a bed, on the floor, any surface, and I want you to grab anywhere from a 1 to 2 pound weight, and I want you to start lying on your uninvolved side. So we're going to make my left side my involved side, so I'm going to lie down on my right. First exercise here, you're going to put your elbow on your side, sometimes using a towel underneath your elbow and between your body for a little support. It can be a little more comfortable. You don't want your arm all the way back here. You want it directly onto your side, maybe a fraction in front. And then from here, all you're going to do is you're just going to take that one up to about a 5 pound weight, and you're just going to rotate up as far as you can comfortably, reasonably go, and then slowly back down. So I'm probably going a little quick on the way down. You can go somewhat quick on the way up, but take it nice and slow on the way down. Strong up, slow down. And like I said, anywhere from about 1 to 5 pounds should be sufficient. And as far as reps and sets goes, I would target anywhere from 2 to 3 sets of about 10 to 15 reps. And what you want to feel as you're doing this is a nice burn right here on the side of your shoulder. Like a muscle burn, not a nerve burn. After that exercise from here, take that same weight, put your arms straight out in front of you about shoulder height, parallel to the floor. And then you're going to lift straight up so your arms facing the ceiling. And then back down so it's parallel again. So again, that's straight up, back down to parallel. As you're doing this, be mindful and make sure you're not rolling your body and you're only moving your arm. Good. And same deal as the first exercise, target about 2 to 3 sets of about 10 to 15 reps, anywhere from 1 to 5 pounds. Good. I'm going to show you 2 more exercises here. For this next one, you will need a TheraBand. I would start a little bit on the lighter colored range. This will start out maybe a little easy, but as you increase the repetitions with this will get fatiguing awfully quick. So for this, you want to stand up. If you need to sit down for it, that's totally fine. You're going to put this band around your wrists. Arms are going to be relatively straight. You don't need to lock them out, but you're not bending them here either. Just nice and relaxed. And you're going to pull the band apart. You're not trying to rip it in half. You're just trying to get into the tension. And just raise your arms to about shoulder height and then back down. Try to maintain the tension as you're going through these repetitions. Try not to relax and reset. Maintain the tension. Shoulder height, back down. If that feels okay, you can start raising up more towards over your head. And for this, you want to feel a good burn, again, right on the sides of your shoulders and in the back here as well. You don't want any sharp pinching pain across the front. If you decide you want to make this a little bit harder, instead of sustaining pressure out like that, you can do a little oscillations as you raise up and as you lower down rather. So for this, like I said earlier, this can get pretty fatiguing pretty quickly. So about 2 sets of 10 reps of this is usually sufficient. If that's not enough for you, however, try about 15 reps or tack on the 3rd set. Good deal. So I'm going to show you one more exercise. Again, go back to your 1 to 5 pound weights. You're going to start with your arms to your side. And you're going to begin raising up about shoulder height, not necessarily directly in front, not necessarily directly to the side. but think about maybe about a 45-degree angle, and then back down. Now I said maybe 45 degrees because it doesn't have to be exact. Just split the difference between in front and to the side, and that'll be sufficient. Once you get that dialed in, you're gonna raise up, again, the shoulder height. You're gonna pull back so you feel like your arms are in line with your body, not all the way back here, just to about midline, and then you're gonna slowly lower it back down. And then you go up again about 45 degrees, pull it back so your arms are in line with your body, slowly lower it back down. Again, that's 45 up, straight back, nice and slow down. And again, try about 2 to 3 sets of about 10 to 15 reps, anywhere from 1 to 5 pounds. So what we're trying to do here is just try to strengthen your shoulder and your rotator cuff. You don't need to consistently do rotational exercises to strengthen your rotator cuff. Its primary job is to stabilize the shoulder and the joint, and regardless of the movement, your rotator cuff is always active. So you don't think that you have to do this all day long to strengthen your rotator cuff. Any kind of movement, some more than others, will get that muscle to activate. So we want to try to do some exercises that activates it, gets your shoulder stronger in a way that does not increase your pain. So give those 4 exercises a try, 2 to 3 sets, 10 to 15 reps. Let me know how you're doing. If you decide you want something a little bit more personalized, please feel free to send me a direct message. I'll give you my contact information, and we'll go from there.